This is Mikael Nordfors with part 4 of a course in tendon attachment therapy. This one is about the stomach muscles. While watching this video, please stop the video between each muscle and try to find all the mentioned tendon attachments on yourself or the body of a friend. This will literally give you more of a hands-on experience. The first one is called rectus abdominis, or the six-pack in popular language. It's almost always tense if the back is tense, as it must be the same tension on both sides of a joint, or else it will move. This is physical law, and a very important point to remember when treating all muscles. You must always treat both sides, else the tense side of the other side will trigger the other side, the opposite side, to get tense again. If we start treating the abdominal muscles, it will be easier later to treat the back. And rectus abdominis is a very good muscle to start. Here on the crest of pubis, the upper part of the pubic bone, is the origin. And this point is very important and very often tense when you have back problems. Or if you are pregnant, this is also an important point, because the pregnancy makes a big load on this muscle. The insertion is on the costal cartilage of ribs 5 to 7 and the xiphoid process of sternum. Most important point to press is here, under rib 5. And this is a very important point, because when you're sore here and have pain here, it can be misinterpreted as a heart attack. I had many people coming in with ambulance as heart attack patients, where it proved to actually be a sore muscle attachment of the rectus abdominis muscle. Most of them were very surprised to go home free of symptoms after a few minutes of tendon attachment therapy. Of course, we also checked the ECG and everything, but that was, of course, okay. Next muscle is called obliquus internus in Latin. It has its origin from the iliac crest on the hip bone here, and the insertion is on ribs 5 to 12, just on the border to the abdomen. It acts as an accessory muscle of respiration and is an antagonist or opponent to the diaphragm. It rotates and side bends the trunk by pulling the rib cage in midline towards the hip and lower back of the same side, this direction. And it acts together with the obliquus externus on the other side, who do the opposite thing. It pulls the trunk in the other direction. It has basically the same origin and insertion on the rib cage, but also the origin is on the inguinal ligament here and the linea alba here in the middle. And it also acts as an accessory muscle of expiration, presses air out from the lungs. Then comes the major inspiration muscle, the diaphragm. And this one has a very strong relationship to anxiety and respiratory problems like panic attacks or asthma. And this one is a bit tricky to reach, but the place to press is between processus xiphoideus and the costal arch here, and upwards and inwards. There you can find it. And you must press here until the pain is gone. Then the patient will breathe better. The next muscle is also very important. It's the iliopsoas muscle. And this one is very connected to stomach problems. I will explain that later. The origin is on the inside of the hip bone, the iliacus part. If you go just over the hip bone on the inside, medial, and press inwards, you can find it here. And the other psoas part is on the front of the back here. And now you can see that how all the nerves to the stomach are going through these muscles, and many blood vessels too. So if you have a chronic tension here, the stomach will not function properly. And that's the reason why there is a connection, that's very officially proved, between chronic back problem and IBS, the irritable bowel syndrome. The insertion is here. You go deep down between the adductors and quadriceps muscles of the thigh and to the trochanter minor and a bit down here. And you can see here the insertion better here. This is the trochanter minor from the back, psoas and iliacus. And this one is very important. You should always press here until the pain is gone on all patients with stomach, back and hip problems. And that was all for today.